Thank you very much for giving us the opportunity to provide opening remarks. Today we'll talk about how we manage heart diseases and how to live healthy with it. We would like to acknowledge that our icon office is situated on the traditional, ancestral, unceded territory of Musqueam, Squamish, Teslevatlat peoples. I would also like to acknowledge that you're joining us today from many places, near and far, and acknowledging the traditional owners and caretakers of those lands. And I will ask Ripujit to tell us about her. My name is Ripujit Karundava. I belong to city of Bathinda, but I was born in city of Faridkot. I did MBBS from Ludhiana, then MD anatomy from Amritsar. With that, I'm connected to Panjabi culture, and I joined the dance, Gidda, Uli, and Pangra teams of the college and MC College. With my education, I joined culture programs and I also joined conferences and as well. And I was attached to different forums. Thank you. Let me tell you something about myself. My name is Harleen, and with Icon for 6-7 years. Other than joining Icon, I'm pharmacy specialist in medicine, and my purpose of today with Icon is that you understand about your health, about your rights, so you know about those, so you can get information about your health. You can get all the information today so that you can take care of your health in future. What is ICON? ICON is Intercultural Health Network. It's with the University of British Columbia with the digital emergency medicine. With ICON, Ministry of Health also supports ICON, and they are partners with it. Why ICON does this programs? To assist multicultural and indigenous citizens, patients, and caregivers. If it is you or your family member, or your healthcare team, your doctors, pharmacists, dietitians, or your physiotherapist, occupational therapist, any team members that assist you, so you can get information about that. So our focus is to optimize chronic disease prevention and self-management. There are many examples of chronic diseases like hypertension, blood pressure going up, diabetes. You can also call it blood sugar. And these are just examples of some chronic disease. The chronic disease, why they are so important? Because sometimes they are with us for so many years, sometimes we don't know how they will affect our health for longer years. Sometimes we have it for so many years and we don't have any problem. Sometimes you have blood pressure, and for many years those can occur, and it can affect your heart, and it can affect your brain and your kidneys. It can affect your kidneys as well. So about all that we will talk, and we wish to talk about those so you can get all information about those subjects. We also want you to know if you want to get some information online, if you read anything online, then you should know what you're reading, it is reliable or not. We also want to tell you that today. We also want to tell you the professionals, the specialists that we have today, you can talk to them today. Now I'll invite my next speaker, Harleen Chohan, to the stage. Harleen did her graduation, and after getting clinic pharmacist degree, and she started working. Now Harleen will come to the stage and tell you how to how we make alteration in our life and manage at home, how we can live a healthy life. Harleen, it looks like everybody's tired by now. Honestly, so thought that you teach me. Uh, I taught you so much. Now you will teach me. We'll learn it together. You will tell me if these things are good or not. The doctors did their job, told us to do all this, and what we do as patients, what we do at home, how will we do it. We'll talk about all that today. So, in there, I'll tell you what you can do at home. How can you do exercise and control alcohol? Doctor talked a lot about that. We'll talk a little bit more. How to monitor your medications, manage your medication, check your lab results, and we'll learn a little bit of that. So we think heart disease, or there's so many things that there's nothing we can do about it. One is age. As we are growing older, it affects your health. But there's some things you can't do anything about. But there's some things you can do about it. High blood pressure. Can you do something about it? Cholesterol. Can you do something about cholesterol? Diabetes, sugar. Can you do something about that? Can you do something about exercise? Can you do something about the weight? So there are a lot you can do. You can do something about age? No problem. But we'll do rest of the things. Why I'm saying this, that we need to manage our health at home. As I said, when you go to the doctor, they'll have the same information that you provide to them. So if you don't check your blood pressure at home, then you go to the doctor and ask them to check the blood pressure once. Will that make any change? Will that help? So if you're checking your blood pressure at home, then you go to Dr. Chima. You can say, my blood pressure was like this during last week. Do you think it will help Dr. Chima a little bit? Same thing about diabetes. If you check and tell him, they can do something about you. There's one thing they can cheat. That's A1C. A1C is doctor's method. If you're lying, they are going to check if in last 3 months, what was your sugar level. Then they know. There are red blood cells in your blood, and then those cells, they stay in your body for 90 days. And those blood cells are so smart, and they say, we like sugar. Oh, that sugar gets stuck in your blood, and then you tell your doctor everything is fine, and then they check A1C for last 3 months. The blood cells are telling him that you're lying. So that's why A1C, they do that, because when you're not checking it every day, some people don't need to check it every day because they know, so they can know how much glucose is in your body. That's why A1C is important. Before we talk about anything else, I want to tell you, if we used to talk how much alcohol you can drink. The answer is there, but you tell me your risk of heart disease. If you don't drink, what will be your risk? 0. Then there will be no risk. They used to say that you can have 1 or 2 drinks a day. They have changed it all now. The new research showing that in a week, if you have 1 or 2 drinks, that you have less of a risk. Remember, if you don't drink at all, that's the least risk. If you take 1 or 2, That's a little bit of risk. More than 3 drinks a week, more risk. Why they're saying reduce it? It affects your health. And second thing is alcohol has effect on cancer as well. If you drink more than 3 drinks a week, your cancer risk also goes up. Not just in men, it's also in women as well. That's why they changed it all. If you drink more than 7 drinks a week, it affects your heart disease, and also affects your brain. It can cause you a stroke. Where does it come from? It's not like how many drinks you're going to change today. That's why they changed it. Second thing, we have talked a lot about it, about physical activity. We're talking about exercise. So many people told us today, if you want to do exercise, that 2.5 hours in a week, from moderate to vigorous, your body should feel it, that you should force yourself. So 2.5 hours a week. If people are asking what does it mean, so the moderate activity we're talking about, meaning exercise. What does it mean? That your heartbeat should go up. You move around a little bit, that you feel that your heart is beating faster. And second thing is vigorous activity. That means more powerful exercise. When you're running, that's what it is. That's vigorous. Then they say aerobic. Aerobic means that affects your breathing. That you have hard time breathing. So many people say, how many people go for a walk, and how many people when they are walking, their heartbeat goes up. If it does, that means you're forcing your body, and they can still talk. That means they're not moving fast enough. If you can talk, you're not moving fast enough. Now, how can we do it? So your physical activities guidelines that are showing that at one time when you're doing exercise, it should be at least for 10 minutes, minimum for 10 minutes. It can go up more than 10 minutes, but it should be 10 minutes where your heartbeat is going up and you're having hard time breathing, so having hard time talking, sorry. It should not increase it all of a sudden. It should gradual increase. It's not like you go today, like go home, start doing exercise, running, when you haven't done anything for the last 6 months. So every day increase a minute. And we're talking about aerobic exercise. Aerobic exercise, where you have a hard time breathing, it's good for your life. Then your heart is doing some exercise as well, and so your whole body can get blood. Second thing is that's very important is to make strengthening exercise. What is strengthening exercise? It's better for your joints, your bones. Those are the exercises when you're doing up and down the stairs. When you're lifting something heavy, do yoga. Why is it important? When we haven't used our body for such a long time, and all of a sudden if you start running or doing aerobic exercise, it's hard. You need to make your joints powerful more. People like me haven't done any exercise 6 months, then they all of a sudden they do too much, then they're hurting and they don't do anything for a week. So it's why important to do strengthening exercises, stretching. It's very important. So you can do it all together. But when they say 2.5 hours a week, that for the first time, you should have heart time breathing. There's so many questions about blood pressure, how you check it at home. How many people have blood pressure machines at home? How many people check it at home? Yes, a lot of people do. Okay, there are experts here. How many people check blood pressure after drinking tea or coffee? You don't. Why not? It goes up. I mean, I told you there are so many experts here. Second thing, if you go down the stairs all of a sudden and you're still having hard time breathing, should you check your blood pressure? Why not? It goes up. If you're wearing tight clothes, should check blood pressure? Why not? If it is already tight and you put a machine on it, it will go up. So what are we saying? If you have eaten anything or drank anything, stop, sit down for 5 minutes, your clothes should be loose, then you put your blood pressure cuff on. How many people check blood pressure? They start yelling at each other. Don't talk, because when you talk, blood pressure goes up. And last thing, when you're checking blood pressure, your arm should be next to your heart, like this. It should be at the same level. You can look there on the photo. Don't cross your legs, right? Keep your legs straight and keep your feet on the ground straight. That is the way to do it. How many times you need to do it? People ask that. It's up to you. You can do it once a day, but do it same time every day, right? That's all it's showing there. Before I go ahead from blood pressure, some people must be taking blood pressure medication here. These medications will work if you take the medication every day. If you stop taking medication, your blood pressure can go up. But sometimes blood pressure can go up and down. If you are sick or something, blood pressure can go down or up. You can talk to your family doctor about that. But if you think that with the medication you're feeling dizzy, you're not feeling right, and you started a new blood pressure medication, you must talk to a family doctor right away. Don't wait. Maybe your blood pressure is too low. So before changing your blood pressure medication, you should talk to your doctor. And second thing, when they go to India, they take medication from there. The combination of their blood pressures are different than here. Dose is different. The combinations, sometimes 3, 4 medications are together. There's so many different medications that are available there or here. I'm not saying those medications are better or not, but if you're getting medication from India and here, once you start taking new medication, make sure you tell somebody. So if your blood pressure goes really down, that's not good either. It can affect your heart, right? Now I'm going to tell you quickly about diabetes. First of all, with the diabetes, some people check. How many people checking blood pressure at home? When you check it, blood sugar, there are two things: before eating, after eating. Because after eating, it goes up. Then you can keep record of it. You know when sugar goes up, what you do, but we don't know what we do if it goes down. If your sugar is below 5, don't drive. And if it is below 4, and you're not feeling fine, and you're sweating, and you're trembling, your heartbeat goes up, check your sugar level. If it's below 4, you need something. You can give yourself milk, you can give yourself glucose, 15 grams. Take some honey. You can put sugar in your water and drink it. If it is below that, take all that, check after 15 minutes, and then you need to eat something again if it is below 4, because you can lose consciousness, have seizure if the blood sugar is really low, right? We don't have time for this. I want to tell you about your heart medications. This question came this morning. If you have stents in, even if you don't have stents in, you had a heart attack or fibrillation, oh, the heart rhythm is not fine. Then they give medication to thin your blood. So blood thinners are prescribed. Aspirin, there's one, warfarin, could be on warfarin. There's a new one, Liquis, Pexaban, Rivaroxaban. Those medications are fine because they need to thin your blood. One thing you can do yourself at home, if your blood is very thin with these medications, and you can have bleeding anywhere from your body. How would you know if you're bleeding at home? No. If at home you start bleeding all of a sudden from somewhere, go to washroom and there's blood in there. And if you go to washroom and if you see dark brown spots, that means that it's possibility of bleeding somewhere. Don't take this lightly. If you start seeing blood while passing, urinating, tell your doctor or go to the hospital, right? Otherwise, you can take these medications, fine? I'll leave this. And there's one more thing I need to tell you about medications. What happens on January 1st every year? You pay for all your medication. Why do you pay for it? Because you're enrolled with PharmaCare. It's good to be enrolled with PharmaCare. It's a program of government that covers your medications. How does it cover it? According to your income, based on how much you make. PharmaCare, as you pay taxes every year, every January 1st it changes. So what happens? We go to the pharmacist. Last time it was covered, this time it's not. The reason for that is, it's based on how much you earn a year. Your deductible changes. What does a deductible mean? Deductible means, how much money you make in a year. Based on that, you have to pay every year. So if you have to pay $100 from January 1st, if you don't pay $100 up to that moment, your medication is covered. If you notice it's January 1st, you have to pay something, that's the reason for it. If you haven't filed your taxes this year, your PharmaCare can end. It's not PharmaCare, BC Services. Everybody gets it. Some people don't have PharmaCare. You can check with your pharmacy. Do we have PharmaCare or not? So you know your medication is covered or not. So check with your pharmacy for sure. That was the last thing from me. Digital tool, I talked about it earlier. Within this time, that's all we will talk about, right? Okay, I'll end it. Thank you.
Thank you very much, Harleen. So, Dr. Chima, first question for you. The question is, the medication are given after the heart operation. How is linked with the dementia or or Alzheimer? The medications that are given after the heart operation, is it linked? Is it linked with the dementia or forgetfulness? No, there is no link. If you are already have early dementia or depression, then it could happen. So we are all are in confusion. The blood in our body, cholesterol, sugar, or the other things that those things that are reason for stroke or heart attack is not only affect the heart but it affect the whole body. So overall, you have to manage your health in this country or any other place. There is no doctor who can prescribe the medication that could be that could damage your health. So take care of your health. Yes, is healthy approach is very important. There was there are billions of people who don't have doctor, they are managing, so you can manage. We are depending too much on the system or on the on the doctor, and that's damaging. The next question is for Kashmir ji. The question is, if there is so too much stress, so how it affects the heart. In the presentation we agreed whatever we think, it affects the whole body. When we are stressed out, we know on our heart and other organs get affected. There is a connection. So we also talk about what we can do to manage our life more. So if we change few things in our life, we can slow down our life. Or if there is a issue, we can go talk to someone, and it really makes a difference. Thank you. Next question is for Vaneet. This question came many times. How many times we can have tea during day? Okay, because the answer to this is lengthy. So please give me that much time, and if I go over, let me know. People who don't know what is a registered dietitian, I tell for their information, registered dietitian. They are part of Canadian healthcare team, and our training, our education is is a different. It's about holistic health and diet, how they are linked to each other, how they're connected. That's our expertise in healthcare. If your questions are related to that or any diet, then you can talk to the dietitians. Dietitians are present in public health. With the healthcare department, they work with them or privately. So you can talk to dietitian, because how much tea you can drink, it depends what you put in the tea, how much what percentage of milk you are using for your tea, how much sugar you are putting in, it depends on that. Other than that, our science, it doesn't consider tea a bad thing, but if we are having it several times a day, so what material, what things is replacing our diet, so that will affect our health. What tea is replacing in our diet? If you're drinking 2 to 3 cups a day during in the morning and didn't eat breakfast, so the balance in your diet cannot be achieved because you missed a meal. Sometimes we drink tea and miss the meal. That will affect your health more. That's why the question how many times you can drink tea, the answer varies depending on your lifestyle, age, diet. But if you want a short answer, I would say that the tea in our culture, we only drink that time when we sit down and we speak from our heart. We share our things. If you have chances, if you are getting chances just to lighten your heart, talking about things, then But if you are drinking tea because your life is so fast and you cannot avoid it, then and the other things like energy, nutrition, sleep, health, you should be careful about that before talking about tea or decreasing the amount of tea. I hopefully I answered your question. The talking about tea, do read the history about tea, 150 years old. People, countries, people drink tea. It's not an issue. It's a kind of antioxidant in the body. But we shouldn't we talk about that. But the addition we make, sugar and milk you put in the tea, that's the one. If there is issue about intestines or stomach ulcer or something, but avoid the hard, like the one is very much boiled, and avoid that. But if you take tea 2 3 times, it's a social kind of thing too. If you are read the Indian Punjabi history, the colon cancer was very rare because everything was diet based. So don't worry that much about tea. The main issue is everything else we do. Yeah, how much you are eating, what you do, how if you eat laddus, gulab jamun with tea, burfi, and then you bring pinni in then the relatives are here. We're not gonna stop them from eating. In Surrey, where we are living, look at the shops. Whatever, did you ever ask what you put in these sweets? Did you ever ask? Go ask them. It's not about only tea. How how many calories in one rasgulla? 350. In one gulab jamun, 300 calories. Do exercise, walk. But if you eat two laddus, it's all gone and the drain. So these are the practical things. We are very simple people. So we should be straightforward. No excessive amount of money is also dangerous. One thing you need to remember is whatever restaurant you go to and eat food, I'm sure Vineet will agree with me. Do go see their kitchen, how much is clean, how much they are frying the pakoras in that oil. So all those things very important, crucial. So your doctor, your dietitian is all the specialists, whatever they're doing, do because you are not managing your diet, it goes into drain. Whatever work your healthcare professionals do for you. Look, it's not that we are thinking that there is a profession. You come to my office, if there my it's not clean. So if you are going to a restaurant, have it's not clean, how you can manage? You go if you go to somebody's house, the washroom is not right, or it's not good hygiene, is smelling. It's not the you have to protect yourself. It's not about that person's personality or anything. Not that anything that's available and you eat it. You are paying for it. You tell them, you ask them, they will be embarrassed about that. Like, how you make the sweets. Look, acid is important for the body in our saliva. It's very important for the absorption. We cannot stop it, but how you manage it, it depends on your aztec food, citrus fruits, oranges, all these categories. Avoid them, reduce it. I missed the talk. You should eat whatever you is comes in your fist. Yeah, eat according to time. The SAT. Our people are in a lot of confusion. It's only our diet that's responsible, and where we came from. There is a bacteria in the water. It It sits in our body and it gives us so much. I don't have time to talk about that because I was late. I didn't hear the whole conversation, whole talk. Control your eyes and your hand, and you will have a good health. I request to those people who send the questions in the morning, they are waiting for it. And if you can, I can please ask those questions. It's from the morning, this question. Silent heart attack. What is silent heart attack? There are blood vessels, there is valves, nerves. Why we feel pain? When the blood is not reaching to heart, the muscles start shrinking. So that's why you feel pain. Silent attack is when our nerves are not working. Because you are diabetic for a long time and you don't know if you actually have a problem or not. The common presentation is not a chest pain that we feel problem, shortness of breath while walk. While I go upstairs, I feel shortness of breath. Then you don't know silently is there is a problem going on in the heart. Silent means you don't know what is going on in your body. Diabetic patients, people who are with high blood pressure, with high cholesterol, whenever you feel shortness of breath, whenever you feel shortness of breath, meet your doctor, get the test done before we do where we're doing ECG. There is no point. Just go for a stress test, go for a scan, and then there is a confirmatory test, angiogram. It's called angiogram. There is no point of going beating the bush. The thing is, if you have excessive cholesterol, excessive sugar, excessive body weight, and if you have problem, then this is silent attack. When you don't know, it's not a magic. It's our body. Its presentation is like that it will not let you know. Next question. There are two questions. One question is yeah, the cashew, walnuts, triglycerides are more. Is it uh, damaging? If one person is eating one egg per day, is there an issue regarding the cholesterol? And there is a myth about this question. Nuts, triglycerides. There are no triglycerides in the nuts. Triglycerides are in our body. There are things that increase those, and there are things that reduce. If we eat sugary food, anything we eat with sugar, then if you eat the peanuts that are coated with the honey or sugar, then we have to be careful with the glycerides. If you wanna lower your triglyceride, then consult the guide. Then eat nuts. HDL are present and they will help you to reduce your triglycerides. But how much? Whatever, that's the handful, like in your fist, and like not like we are eating cashew burfi, dry roasted without sugar, without salt. 4 5 almonds or or cashew or walnuts. So these kind of things you can eat. The second question is about the eggs. Before there was a myth that the eggs have cholesterol, but the new science and evidence is you can eat eggs. That's what it says. Though you don't have to worry about your cholesterol, like how much eggs you eat. So maybe one egg a day, 7 eggs per week is moderate, and you can eat it. The next question is for Kashmir ji. If you want to see a counselor, how we can see a counselor? Do we have to go to doctor, or how we can see a counselor? Is it free To see the counselor, you can go online, BCACC, our association, but those services are costly, you have to pay for it. But when you are working for some business, you have extended healthcare benefits. You can get your death, you can buy glasses, you can clean your teeth, you read your package, mental health services, to read that if there are mental health services present. Sometimes you have to pay from your pocket, and then the counselor give you a seat, and then you can claim, you will get reimbursement. If you don't have that, and if you can't afford that, so then you can go to community services. They are low cost or free counseling service. There are available in the community health, as I told you earlier. So you have to advocate for yourself, and you have to search, and you will get a service from somewhere. The next two questions are for Dr. Chima. Home is about home remedies. What are the home remedies? Are good? Are they good? The second question is, and the medication, the allopathy and homeopathy. The people who came from India or Pakistan, we are mostly Panjabi. 60, 70 year before, did you hear cancer? Somebody dying with cancer or heart attack? All these things we are doing. Whatever we learned from culture, lentils, garlic, ginger, spices, all those things are very important. So considering all these things, in the Western, they modified it, gave new name, our spices. For example, garlic, it blood controls the blood pressure, cholesterol, and anti-inflammatory things. Turmeric is there are capsules, and it will improve your joints. They are very important. Everything in moderation. Second question is also related. If you have heart problem, you are taking aspirin, you are taking turmeric, and your blood will be very thin. Don't just hide your medication from your doctor. Tell them, these are the things I'm taking, these are the medication I'm taking. Pay attention. The homeopathic or Ayurvedic medicine doesn't hurt you. No, it will not affect anything. Is for your prevention is very important to maintain your body. The second thing is, people who have less money, people who are in South India or near the coastline where the weather is good, environment is good, they use all these kind of spices. They are very healthy. They don't have heart attack. Their complexion is good. So all these things. So our culture, our civilization, our medication here is acute care medication. You tell your doctor you have heart attack, and you will have you have an operation, but your dietitian is going to tell you what the things to eat. Before, the diet was Mediterranean diet. There were many names here for the diet. The Punjabi diet, spices, all those things are good. And there are fights in the world because of these spices. The spices are very important for you. So take. Do you agree with me? Yes.
We are all trained. We go to the doctor, family doctor, specialist. They don't have answer for everything. A psychologist, dietitian, talk to them. Somebody who can coach you spiritually. If you go to the church and just pray there, that's not gonna help. Do some yoga, do some deep breathing, hot yoga. Avoid that. Yoga is fine, but sweating excessive sweating is not good. You just have illusion that's, they're taking your money. Uh, Sweating is to maintain your body temperature, to keep it cool. So do yoga, do exercises. Spices are important. So, good quality spices. Uneet, anything you want to add? Yes. I just want to say the real medication is your diet. Even in Western medication, or even say in Punjab, the balanced diet is important, the healthy eating. That's best preventative medication. If we bring some balance to it, eat healthy, then we can keep our health healthy. But once you need Western medication, then you should consult your healthcare team. There are many professionals in your healthcare team, and they can give you the best advice what to eat. Based on your medication, they can decrease the side effects of the medication and make it more effective. And we should add that into your diet when you're taking medication. There's so many foods that you should not be eating because they interact with your medication. So if you don't have any illness or disease, then look after your health and eat what's good for you. And if you have a disease, then talk to your medical team. Tell them you're trying these remedies. And the medicine is holistic these days. They can give you advice that according to our science, this is better. That going to eat more or less, or should you eat more or less? The nuts, the lentils. Dr. Chima, three more questions. Then one more Kashmir, then one from Reed. First question: if somebody has excessive breathing, or they're having hard time breathing, is it lungs issue or heart? People who have asthma, they have different issues. But if you have diabetes, cholesterol, and you're having hard time breathing, especially going up the stairs, that's a big sign that you should see your doctor. It's not a minor thing. If you're having hard time breathing, going up the stairs, that's a big thing. Oxygen is not going to your lungs or your to blood. So, it's your lungs that check your heart. And asthma medication, use it properly. Talk to your pharmacist. It's not just you just go and say hello and get the medication. And to use the pumps, how to use the pumps properly, how many times you need to use it, pump or anything else they give you. Second question, I see. Second question is, if you're walking and you have shoulder pain, and if it is going on for 10 minutes, for so many years that you have this problem, should you see your doctor? It's a very simple answer. We should understand the shoulder pain and walking has no connection unless it's on the left side. Move your body, be active, some strengthening exercise there, as they mentioned. You're going to get well. No, you're not going to get well yourself. If somebody is diabetic, their muscles, I'm 70 years old. If I'm not walking, I'm going to get sick. The muscles are not going to move themselves. You need to move it and move your joints. And when you're moving, exercising, it's using sugar. It's a simple things you should pay attention. It's not doctor's job, it's your job. Last question for you. If somebody had a bypass, but their feet are really dry now, again, somebody had a heart problem and they had a bypass, they're diabetic, Do you think it was heart block? The blood goes all over the body, and it goes all over down there. The veins, the blood vessels, everything affects it all the way to the heart and to the feet and other organs, sexual organs. It affects everything. And if somebody has a health problem, had a surgery done, and they're getting swelling, and then they need to control their circulation. When you say go sit at home, don't sit like this. Push your legs up, and then improve your circulation. Lift your legs, do some massage, do some exercise. Best exercise you see to push it. Move your legs and move your limbs even when sitting. Some people sitting and they're saying, give me water, give me food, give me tea. You should get up and, move around and do some circulation. Most of the people who are sitting here, they are fit. I don't see anybody who's that sick, but activity, you need to increase that a little bit. Some people say, Harleen, walk, should I walk barefoot or not with shoes? That doesn't mean anything. Walk is walk. The dirt is not going to change anything in your body. Avoid those gimmicks. Thank you. Another question for me, then for Kashmir Vaneet. I got a question. Brand name and generic. Is there any difference between some they say a brand name generic? Altes or some liquids generic mix one. There's no difference. Brand name medications are only the companies that have they pack it. There are so many years per patent. They have patent for 10 years. When that patent expires, then other companies can make that medication as well. So usually brand name, generic, it's the same medication. And just to keep the tablet stable, what they put in there, that's a little bit different. But the active medication is the same. Only thing is different, insulin. Insulin, a generic brand name. It's a biosimilar. A biosimilar means the medication, the structure of the medication, if you look at it under a microscope, it's the same. It's the same medication, and it's built the same, but it's not the same. Got it? Good? Thumbs up? Just want to add something. If you go to the pharmacy and go anywhere, doctor wrote it for you, Altes or any other medication, they're very expensive. You can't afford it. You have limited income. You can ask the pharmacist through your family doctor or directly yourself. Register yourself with PharmaCare. Participate. Your medications will be free. We get stuck in there somewhere. And you say the medication is not fine. All the medications, go get it yourself. There's no problem with it. It's the same. A pharmaceutical company, and sometimes we have a 12-year patent in India, they make it, it's just up to you. You feel that it's different, it's cheaper. Cheaper doesn't mean it's not good. Next question for Kashmir. Kashmir, if you talk to anybody about your problems, is that beneficial? If you talk your heart with somebody, does it help? Well, you know the answer to this question. What happens when we keep everything in our heart, in our mind? We don't talk to anybody, we don't share with anybody. Does it affect us or not? Yes. But as we said earlier, if we have tea with somebody, you talk to somebody, you share with them, I'm like this, how are you? Don't you feel lighter? Don't you think, they listen to you, you heard them, it affects, it helps you. If you take it to the next level, first the counselor, there are no counselor therapists. You just talk to somebody who's close to you. But now, if it is something serious, our friends or relatives are not able to help you, then professionals can help you with that issue, right? But everybody should have a person or two in their life that they can talk openly with. You asked a question, do you need doctor? I forgot to answer. You don't need doctor's referral for psychologist, psychiatrist, for a counselor, but for psychiatrist, you need doctor's prescription or referral. Last question of the day for you, Nate. It's a very big question. You said coconut oil is not good. We have been using coconut oil for years. What do you think about coconut oil? The coconut oil, we call it saturated. We consider it saturated fat. The saturated fat is built in your body itself. We don't consider it fat. If we increase saturated fat in our diet, it's gonna go in there, and it's gonna create plaque in your blood. What we call metabolic processes. Your question is: there's some countries, there's some places, they've been using coconut oil for years. Even in Punjab, we used to eat a lot of saturated fat, milk, buttermilk. But now our lifestyle here has changed a lot. We don't live in a warm place or hot place, and we don't work as hard. So that's why our saturated fat, we need to decrease it in our diet so that it doesn't go into your body and get stuck there and affects your heart disease. Some people have their coconut oil their whole life and it doesn't affect them, but look at what they did throughout their life and what kind of work they did. I just want to thank all the speakers that you explained everything and answered all the questions so simply and clearly. Now, going forward, there are two more door prizes that are left. So I'll ask you to pull the tickets out, and Harleen will pull out a number. And there are two prizes that are still pending. Last time somebody got a ticket, so please, I'll give you another second or two. If you're ready, you can give me thumbs up. Many people are ready. First one is 470. And from now on, we sow a seed into everybody's mind about knowledge. And they're outside, and there are flower plants on every table outside. And as I said, we give you knowledge today that you can take those plants just like those are outside. Thank you. And I wish to thank our community partners that gave us sport to promote and make it successful. And thank you for media partners as well who improved it and told about this every event, and you could be here. And the presenters outside, the exhibitors, and you went there and you gained the knowledge, and I wish to thank them as well. BC Renal, City of Surrey, Diversity Options, PICS, Richmond Multi Community Services, Self Management BC, South Asian Health Institute, Surrey North Delta Division of Family Practice, and most importantly, the speakers. And I wish to thank them very much from bottom of my heart. Dr. Baldev Singeda, Dr. Tarun Sharma, Vineet Kaur, Kashmir Based, Dr. Guljar Chima, Harleen Chohan, Ajay Singh, who gave us, fresh in our mind, Deep Sidhu, and Heart and Stroke Foundation, and translators who, some speakers who are learning. Thanks to the interpreters as well, Navdeep Atwal and Pradeep Bains. And from Ministry of Health, Ministry of Partners, and UBC as well, and Ripajit as well, who hosted this event today. Thank you. And first of all, I wish to thank you, all of you who came here and participated and made it us aware about our health and give us wonderful information. You can get all the information, whatever we did today, the recording and everything. We'll put it on our website www.iconproject.org. If you have borrowed any headsets, please return it at the registration before going. Our next event, and it's about chronic pains, to understand and manage it, will be Dr. Smith Chawla next Saturday, March 16, Guru Nanak Sikh Gurdwaras. And you're most welcome to join us there and attend the workshop there. Thank you. Salutations. Goodbye.